we have an affordability crisis. And to attack that, we have to have different business models in place, different care delivery models in place, and different experiences in place to navigate towards those care models. So ultimately, building affordable products for health plans and helping them put that in place, that's our role and what we see we need to do. When I look at the technology front, the areas that Gen AI can help, what I would love to see that help and where we're certainly targeted is how do you make that experience for the member and the provider, help them navigate the benefits, right care, right time, right place, help the provider navigate for the member to do that. Because if we don't, we're never going to attack the affordability challenges that we have.
Welcome to the A&M Significant Healthcare Voices podcast series, featuring insights on healthcare trends and hot topics direct from industry leaders.
Welcome to A&M's Significant Healthcare Voices podcast series. I'm Doris Stein, a managing director at A&M's Healthcare Industry Group, and I'm joined by my colleague and co-host, Kristina Park. And Lori, we are thrilled to have you joining us today. Lori Logan is president and CEO of NASCO, a leading healthcare technology company that provides digital health solutions for health plans. And Lori has more than 30 years of experience in healthcare. She's held leadership positions at TriZetto, United Healthcare, Cigna, and we are very excited to learn more about your career, Lori, and look forward to diving into some conversation. And everyone, welcome to the podcast. I'm going to have Kristina introduce herself and then Lori.
Great. Thanks, Doris. And Lori, it's great to see you again. Thank you for joining us. Kristina Park, Managing Director in our health group.
Yeah, thanks. Great to join you both today. Excited to have this conversation, and it's an exciting time in the industry, so look forward to it.
Great. Lori, so first question, you've had an incredible journey through some of the most influential healthcare companies. Talk to us about your early roles at Cigna, McKesson, and how that shaped your journey in healthcare innovation and how that led to where you are today as the CEO of NASCO.
So when I started there and I worked with their great people, a lot of energy, what I didn't realize is how innovative it was. I thought that's how all health plans rode. We had great claim systems, we had great planning tools, we had great analytics, we had great provider relationships, all the things that you want in a health plan. But I didn't realize until I look back now, over 30 years, how truly differentiated, they were. One of the projects that I had there, which was a real game changer for me in my career, was we co-developed a software solution. It was first generation medical management solution, so utilization management, case management, disease management. We even back then, this was 30 years ago, had we called it early case ID, early identification of patients that were in need for case management back at that time. And we partnered with a company out of Cambridge, Massachusetts called HPR. HPR got bought by HBOC, which, if you remember back in that day, was a quick fast follow of McKesson buying them as well. And then from there, I went to a startup company. So it's called ChoiceLinks. It was a consumer-driven health plan. Before CDHPs were a thing, we were competing with high deductible plans, but all fostered on consumer choice. What do I need for me, my benefit plan? What's the actuarial models behind it? How do you put that consumer choice in place with that? And we basically built a health plan as a startup type of thing in 18 months. So again, all that health plan operations, but with that consumer flair of how do I make it easier? How do I tailor what I need in my insurance? For me, that piece too. So all those early days are still things that I'm fighting for, driving for now, making it a healthcare cycle that works for everybody, patient, consumer, care provider, sponsors of care, all of it has to all work together with us. So it also gave me just that different stakeholder view. So payer, provider, I've been back and forth a lot in my career, and that's not all too common to have the kind of clinical side experience as well as the administrative side. But it started back in those early days, 30 years ago.
That's really interesting. And I know product has been I'm hearing what you're saying, Lori, about the product and how you've been able to kind of see that in the innovation. How do you see the role of product management as we continue, as the industry continues to evolve? How do you see that role of product management really continuing to be innovative and continuing to address some of the market needs in the ecosystem? And how do you see product management sort of changing healthcare or kind of evolving healthcare in the coming years?
Product management has always been a very business-driven focus. I think we've gone through the past couple of decades where it started to be more like high tech, focus. And I think that's right for super high tech companies, but certainly not for healthcare. Healthcare has to understand the business of healthcare, the economics of healthcare, the experience needs of healthcare. So I think we've kind of seen some evolution of what is product management, early days of it, high tech waves of it, and now getting back to it's about the business, and economics is underneath every business that's out there, with that. What's interesting at this rate and pace and time in the healthcare industry is I think health plans, especially smaller regional plans, are understanding that their need for product management, product strategy, and product innovation has hit an all-time high. But it really is, what's the business you're in? What's the challenges in that space? How can you bring something to market that solves those challenges? Do you have the right to win? And then execute on it.
Great point, Lori. And I know NASCO is doing some exciting things around product and innovation. What trends or technologies are you most excited about as your NASCO organization is evolving here?
Yeah, so I'll bring it back to the foundations of what we struggle with as an industry. And first and foremost, it's affordability. We have an affordability crisis. And to attack that, we have to have different business models in place, different care delivery models in place, and different experiences in place to navigate towards those care models. So ultimately, building affordable products for health plans and helping them put that in place, that's our role and what we see we need to do. I think when I look at the technology front, where I see a lot of process, and there's, you could spend a day talking about the areas that Gen AI or agentic AI can help. What I would love to see that help, and where we're certainly targeted, is how do you make that experience for the member and the provider, help them navigate the benefits, right care, right time, right place, help the provider navigate, for the member to do that. Because if we don't, we're never going to attack the affordability challenges that we have. That's the essence of value-based care, right? Like to right time, right place, right care delivery path. And I think where we can use AI is helping our advocates get out of the agent model and be an advocate, right, for care and help them navigate those pieces. We need new data in healthcare to really drive that engagement cycle. So I'd like to see us move from the call center approach to really an engagement and experience approach. And I think that's a big promise for AI to help us, in that, to get to that engagement platforms of the future.
Great point. And being able to utilize that data effectively, right, Lori? I mean, that's the thing, is some of these organizations we see have so much data that they have, but they don't utilize it effectively. So that's really
has to be
important.
sprinkled into every stakeholder in healthcare, right?
That's right. Laura, you were a key leader in one of the industry's largest transactions, the $2.7 billion merger between Cognizant and TriZetto, and you were awarded the TriZetto CEO Pinnacle Award for contributions. Tell us a little bit more about that.
TriZetto, probably lesser known of TriZetto, is we had a provider business, and I ran the provider business. And the underpinnings of that provider business was from a former colleague of mine back at Cigna days, actually. And the premise was, if you connect payers and providers and put the rails in place to do that, you'll bring down administrative cost and you'll lay the rails open for care delivery to happen, to exchange different types of information. So my role at TriZetto was running the provider business. And by the time we sold and combined in with Cognizant, we had almost 200,000 providers running through our platform. Our channel distribution was through EMR vendors. So we natively integrated with all the EMR vendors, which meant we could present information at the point in time in their workflow to do that. It was a clearinghouse business, right? So we sat in the middle of all the data movement between payers and providers. And what was different about our models, it was all provider revenue. It wasn't a payer revenue clearinghouse where it was a gateway. It's provider revenue. So it meant of those 200,000 providers, those 35,000 practices, we had to sell each one each time and provide a great experience for them to help them earn money, right? To help them get paid, to do that. So it's a really different orientation. So when you fast forward to the Cognizant acquisition, a couple interesting things happened. For me, it was a great experience of seeing really large services-oriented organization of services and consulting, and largely built a lot of big business around TriZetto's platform, right? And the good platform that it was. What was interesting through that is two things. One, the whole provider business was a bonus prize. Nobody knew that they had it, right? But if you think about it from a channel distribution perspective, I had channels into the entire ambulatory provider market to impact change, right? To do that. So it's a really kind of golden nugget in the conversation that added a different value, to it. But what I would say the learning was, it's really different business models, consulting and services versus product. Product, you have to make really hard decisions on product market fit. You can't serve everybody 100%, but if you can get them 90% of the way there, you get commonality, you get aligned thought, you get vision, and you get margins, right? In the business, that's the promise of product, organizations. And general services and consulting's not that, right? You land and expand, and you go into different markets. So the governance and decision making between the two of them are kind of different business models. My role was to understand that payer-provider collaboration, the provider channel and business that we had underneath it, the influence that we could do with that. Like I said, it was kind of a bonus prize in the acquisition. What I learned out of it was an classic example of services company buying a product company, and the inherent challenge and the tension on the business model between the two of them. So being a product person, it was extremely intriguing to me, right? To see how does that happen, and how does the go-to-market happen differently, and where do you make your decisions, and how do you fund, for different areas of investment to get that return out of it.
It's incredible to hear how your roles have changed. And now, right, you are the president and CEO of NASCO. So now we're into the next future, the next years. Tell us a little bit about if you'll share a little bit about what your vision for your organization's role is in shaping healthcare services and technology in the future, and how do you see kind of this next chapter playing out?
Yeah, it's a really interesting time for us, interesting time for me. I feel like I'm bringing all the pieces and parts of my career together and can make impact, for our customers, for healthcare, and why I'm so passionate about it. So, we moved our ownership model about 3 years ago. We're now a wholly owned subsidiary from Blue Cross Michigan, and that was a pretty big change for us. We were formerly owned by several Blue plans and a consortium-owned model, and really more as a shared service, right, to bring together synergies to do common things together at a much more efficient rate. So we've been on a trajectory over the past 3 years, or an evolution over the past 3 years, to really reorient ourselves to the market. What's our product market fit? What's the role that we play? Where do we want to sit? What's the things that we do differently and uniquely that we want to make sure that we tether and we keep our own and we focus on? So, exciting. We're actually reintroducing ourselves to the market this summer with a refreshed brand. The name is not changing. It is still NASCO. It's extremely important that we kept the NASCO name. We have 40 years of history, and our history is with national accounts. That's what started us. What is that? Complex benefits across state lines, taking the complexities of healthcare really head on, with that. So over the past couple of years, we've been focused on that orientation, reframing ourselves. We're bringing a new product to market that helps with alternative payment models. So we have to be able to administer all the healthcare benefits, all the healthcare payments. That's what we do, right? And if you have that administered in a scalable, transparent way, that's what enables the experience and the servicing that we need to do, in the market. So we're introducing ourselves. Our vision is everyone deserves a better healthcare experience, and we want to enable that. Our mission is to make it possible for health plans to innovate, grow, and ultimately provide the better healthcare experiences to those they serve. We're here to empower our plan customers, and we want to help them grow. They grow, we grow, and we're an engineering company at heart, and we put discipline around things and build technology, and we want our technology and our products and our services be oriented around market problems and the products that our customers need to grow. So we think we're in a really great position to reintroduce ourselves. We've got great products and services, super deep knowledge, super broad knowledge, and we get the different stakeholders in healthcare winning of it, but economics matter and affordability matters, and we can help bring those affordable products to market for our plan customers.
It's such an important mission, and it's a great brand. NASCO is a great brand.
Wonderful, wonderful. Thank you so much, Lori. This has been such a wonderful conversation. Thank you for sharing your experiences, your insights, and taking time with us. For everyone that's joined us, thank you for listening. For more information about A&M and to find more of our podcasts, please visit www.alvarezandmarcel.com/healthcare. Thanks again, everyone. And thank you, Lori.